Hello there, John Miller Osteopathic here again. I'm just demonstrating a technique called foraminal gapping, the purpose of which is to decompress the lumbar spine when there's a disc problem. You can do this for all kinds of lower back problems, but it's really good for discs if you're getting pain down your leg, okay, especially going down the hip, on the side, down the back of the leg, and down here into the foot. The way we do this is very, very simple. If you don't have a portable table, just use a bed. It may help you to kneel down. Make sure the patient is as close to you as possible. Take your hand, place it on the top of the pelvis like so, and the other hand somewhere along the line of the spine like this, and you're going to try to pull these two areas apart. You do this by leaning very gently and pulling like that. So the body weight goes down and apart. Is that comfortable there?
Yeah.
Great. And down and apart. So you have to try and do this very slowly, very gently. Sometimes less is more. Don't do too much. And you want to feel along each vertebrae as you go. It's a very comfortable technique. It can really heal a lot of problems down there. For a bit more leverage, you can take this leg, straighten the leg like this, drop there. Taking the arm as well, you can bring it above the head, or you can bring it forward and let the patient roll a little bit. And that puts a bit more leverage here. You can even lay like this yourself without anybody leaning on you. And that gives you a little bit more leverage, a slightly stronger stretch. But after you've done this, always bring the leg back and the arm back. Make sure the patient is relaxed at all times. When I'm doing this, I like to do it until at least I feel a change in the tissues. There we go, all right. And that should help the patient. Usually good to do both sides, but if this is the side where the nerve is trapped, this is the side you want to mainly focus on. After you've done that, you can also work on the hip area. Hip's quite an important area here. The glute muscles attach from down here, okay, at the top of the leg, all the way to the top, around here, and around the sides. So it's a large muscle complex. So what you can do for here is take your hand, place it on the buttocks, and the other hand as well, and using your body weight, don't use your arms like this, try to lean your body back, nice and slowly, just clenching and pulling in, nice and gently, into the buttock muscle. And you can work in lots of different directions. So right, I'm working towards the patient. I can move my position to here, and I can work away from the patient. If the patient has an acute lower back pain, working away may actually be uncomfortable, so you may want to stick with working towards the site of discomfort. But most important, look after yourself as well. Don't lean over too much. Make sure your posture is nice and upright, and use the weight of your body and not the strength within your arms or within your back, otherwise you'll be laying here as well. I hope that helps. That should give you some idea about how to treat acute disc injuries. Thank you.